Welcome to the Baby on the Move conference booth. We are very excited to be presenting at this year's London Health Research Day. This scoping review was conducted as part of a larger project aimed at understanding the experiences of healthcare professionals and parent caregivers as it pertains to the process of transitioning acutely ill and preterm infants in intensive care. Preterm infants account for 10.6% of births worldwide, equivalent to an estimated 14.8 million live births. The rise in survival rates as compared to a decade ago can be attributed to improvements in care as well as advancements in pharmaceuticals and technological innovation, resulting in increasing life expectancies of infants with medical conditions once considered fatal. However, neonates who survive are at greater risk of a range of short term and long term health conditions. Although the risk of mortality and morbidity are higher in early gestation, late preterm births occur more frequently and pose significantly higher risks of adverse outcomes than infants born at term. As a result, preterm and acutely ill infants require more primary care and specialist services, resulting in several transitions throughout hospitalization based on regionalization, specialization, the designation of facilities, and continuity of care. A review of the literature reveals that empirical research and evidence based practices are limited and fragmented in their understandings of how transitions are conducted and experienced from the perspective of those facilitating or supporting the process. To our knowledge, no reviews currently exist. In addressing the gap, the scope of this review was broad in its approach, considering literature focused on healthcare professional experiences of early healthcare transitions. The research question was: what is the extent and nature of the evidence considering the experiences and perspectives of healthcare professionals caring for preterm and acutely ill infants in neonatal intensive care settings during early healthcare transitions? This review was conducted using the six methodological steps outlined by Arski and O'Malley and utilizes the PRISMA Scoping Review Extension checklist to maximize methodological transparency and uptake of research findings. Members of the research team developed search terms with input from professionals working in NICUs, as well as a health science librarian. The search terms were used in various combinations to reflect the core concepts of infant, healthcare professional, the process of transition, and healthcare professional experiences and perspectives. Search strategies were undertaken using five scientific databases, two open gray literature databases, and reference lists from relevant articles in key journals. All English language articles published from 2004 up to and including December 30th, 2020 were considered. Endorsement of the inclusion criteria was an iterative process and were discussed amongst the research team over the course of the search. Inclusion criteria included a focus on infants of less than 1 year in age, undergoing a healthcare transition encompassing a clinical handover from one healthcare service or setting to another from the experiences and perspectives of healthcare professionals. Articles were excluded if the focus of the paper was looking at specific health conditions, chronic illness, singular healthcare services or procedures, and those who focused on pediatric palliative transitions, and studies without results as well. Full text articles were obtained where inclusion criteria were met for data extraction. The study selection process is outlined in Figure 1, and 9 articles were ultimately deemed eligible for this review. A total of 4,045 citations were retrieved, of which 37 articles were retained based on titles and abstract screening. Full articles were critically reviewed in entirety, and 9 unique records were deemed to meet the inclusion criteria. The included studies were from the USA, Norway, England, Australia, and the Netherlands, and represented a total sample of 173 professionals. 4 out of the 9 studies utilized qualitative methods. 3 used quantitative methods, 1 was a conference summary, and the final article considered a patient and family centered approach to change of shift reporting. Across all studies, early healthcare transitions were described differently according to the unique characteristics of each type of transition. However, some commonalities were noted. Transitions was defined as an occurrence of clinical handover involving a transfer of professional responsibility and accountability for some or all aspects of care, was commonly performed in some collaboration of physicians, nurses, administration staff, specialized pediatric teams, and others, including, for example, pilots, paramedics, and others. And this was dependent on need and circumstances of the transfer and infant. This includes some level of structured, timely clinical handover initiated between physicians overseeing care, nurse preparation of the infant, including coordination with other healthcare locations, and necessary documentation, awareness of time sensitivity or scheduling, and informing of parents. The thematic analysis revealed four key themes and nine subthemes across studies and phases of transition. These are included in Figure 2 in the third column of the research poster. The first theme surrounded communication with healthcare professionals and parents. Communication encompassed the largest theme analyzed. Healthcare professionals cite feeling stressed and frustrated within their role due to poor communication and support from other clinicians during transfer. Consequences of these deficits include length of handover, compromised patient confidentiality, missed bedside handover, and the depth and quality of information included. In addition to this, healthcare professionals perceive part of their role as communicating with parent caregivers. Three studies highlighted the role of parents as contributors towards care as a means to engage in strong partnerships and information sharing. The second theme highlights that healthcare professionals are overstretched and under resourced. Healthcare professionals consider transition as a means to facilitate high intake by providing urgent care for infants before transitioning them to lower levels of care in order to allow for more complex cases. Experiences were further structured within discussions of budgets and cutbacks. High intake volumes were found to impact clinicians as units and transport teams note taking on more infants than reasonable for staff levels, resulting in the prioritization of tasks, time, and budget as opposed to delivering the highest quality of care possible. The third theme reveals the unpredictability of transfer. Healthcare professionals highlight an inability to anticipate and prepare for transfer as a concern during transitions across all types. The exact time of transfer was not always known beforehand, which hindered healthcare professional coordination and heightened parents' feelings of insecurity and anxiety. As a result, transitions were reported as events that could not be prepared for, causing delays and inefficiencies in both the exit forms and intake to community nurseries. The most common logistical concerns during transitions from the initiated transfer site were ambulance arriving on time, infant readiness, and completeness of handover and discharge documents. On the receiving end, identifying the correct infant, having cots ready, and ensuring sufficient staffing and skills mixes emerged as concerns for healthcare professionals. The final theme proposes consideration for enhanced transfer documentation. Healthcare professionals identified documentation needs for ill infants who have medical complications and comorbidities requiring specialized care and timely medicine administration at the time of transfer. Six articles made note of facilitating and constraining factors affecting documentation processes. Transfer documentation was found to include either too much or too little information regarding infant care and histories. Lengthy discharge summaries necessitated by the complexity of preterm infant care made finding pertinent information and treatment requirements difficult to pinpoint. Conversely, other healthcare professionals noted that they needed more holistic and complete information to be included in documentation. Building on this, articles report ways in which parents may be able to participate in reporting while simultaneously easing their fears and distress. This review identified that healthcare professionals experience a great deal of stress, uncertainty, and complexity in events relating to transferring preterm and acutely ill infants between NICUs and lower levels of care. It was found that across all types of early healthcare transitions, healthcare professionals experience challenges with communication, overworked and under resourced, unpredictability, and documentation. These themes were repeated across 17 years of research and included healthcare professional experiences and perspectives from 5 countries with varying healthcare systems, highlighting the notion that early healthcare transitions have not been well documented. The majority of studies focused on nursing roles and fall short in considering other professionals involved. Regardless of where or when studies took place, common experiences across the sample emerged. 2 points of consideration were identified from this review. The first being communication, decision making, and information sharing, and the second involves capacity building of parent roles. The first consideration emphasizes the importance and simultaneous lack of understanding surrounding events of decision making and information sharing. Each type of early healthcare transition considered in this review is unique in its organization, logistics, and levels of care and involvement from a diverse body of clinicians. However, communication within the realm of healthcare, in essence, form a nexus of oral and written exchanges of information between various entities and are impacted by professional, personal, technological, environmental, and cultural factors that remain unknown in the greater body of literature. The second consideration seeks to build parent capacity in their role to be involved in a mutually beneficial way that does not add to the healthcare professional existing workload. This review found a few approaches taken to involve parents within the process in a way that positively impacted infant care. By increasing parental involvement in caregiving throughout hospitalization and transition, parents may emerge from the NICU experience with increased competence and confidence in infant caregiving. Future research may aim to consider healthcare professional and parent caregiver experiences of collaboration and communication during infant transition processes. Doing so within a child and family centered care approach allows for the foundation of inquiry to be grounded within the core concepts of respect, dignity, information sharing, participation, and collaboration between healthcare professionals and parent caregivers. Opportunities to improve clinician experiences include interventions developed from a greater understanding and greater investigation into the lived realities of a diverse sample of clinicians, as well as greater consideration into how parents may collaboratively be involved to better support long term health and well being of hospitalized infants. So, thank you so much for listening, and that concludes our presentation.